Now, here's today's host, Dr. Erik Kowalke.
Hey, welcome back. Super excited to be on again this month. Thanks to ChiroSecure for putting these on and just hosting this and encouraging chiropractic care for kids. We're just super excited to always serve more families and more kids. And if you're watching this, you are too. You either see a lot of kids already and you want to know what you can do to do better, or you don't and you want to know how to see more kids. So specifically on this episode, I want to address with you guys common medical fear that you're going to see in patients and what you could be doing to properly educate your people better and educate moms and parents about stuff they're going to see with kids and be proactive with it. Anytime you can be proactive is better than being reactive in all of these scenarios. So again, my name is Dr. Erik Kowalke. I own Higher Health Chiropractic in Grand Rapids, Michigan. I've gone through all the ICPA certification. We opened in 2011 in our office. We see about 40% pediatrics out of 1,000, 1,200 patients a week. So we see a lot. We have multiple doctors in our office. I go around and teach a lot at different universities and schools, and I'm an extension faculty advisor. So I love the topic of kids, and I have 6 of them myself. The last one was just born September 4th. And I love seeing kids just experience true health in life. And we saw VAX 2, I think it's called A Parent's Story, VAX 2, The Real Story, last night. And it's truly remarkable. If you get a chance to see it, I would encourage you, buy lots of copies and give them out to people. It's crazy what's happening in our society and our culture. And chiropractors are uniquely positioned to just see it more often. And I say that instead of battle it, because maybe that's not our number one battle. You know, we can fight subluxation and we can adjust, and nobody else can do that. And even for kids that are vaccine injured, maybe even more so, they need chiropractic care more than ever. And you can see vaccine injury all around you now. I mean, just you see kids in the mall and you see kids places and you're like, that kid's vaccine injured. And there's kids that come in our office and you're like, that's a vaccination injury type of a thing going on with this child right now. And they have subluxations too, and they need subluxations removed so they can experience true health. But I don't want to go into all that today, but I really want to talk about what are the common things you're going to see. We're going into winter flu season. We're going into winter sickness season. We just came from Halloween. So this is the best time of year. You know, nobody was sick prior to Halloween. You have Halloween, and the week after, everybody misses school and everybody's sick. I wonder if it has anything to do with all of the candy that they're eating. Probably. So let's educate them on that. Let's educate them on the immune system. How does it function? How does sugar specifically bind to immune cells and stop them from working the way they're supposed to? And so all of your education material in your office should be around the immune system and how the nervous system controls and improves the immune system. So you can go into the conversation with candy and sugar and how it depletes your immune system. But that's not saying, we're not going at it with the end goal of telling them they should never eat sugar again. We're going at it with the end goal of, we're going to educate them to make wise decisions and choices, knowing that they're probably going to do it anyways. But it's more important to have a proper functioning nervous system if you're going to be doing that than without it. And so we always end, and our goal is to tie it back around to chiropractic care and how it's vital to have chiropractic care, even if you're going to eat the bad stuff that's going to go in your body. Obviously, it'd be great if you didn't. You'll have less sickness. Your body will function better and healthier if you didn't eat that or do that thing, knowing that they're probably going to do it anyways, but maybe they'll do it a little bit less, or maybe they'll just think twice about it. At the very least, if they're going to do that, knowing that it's going to harm their body, they're coming in to get adjusted more frequently to improve their function of their body and their nervous system and overcome that quicker. And that's how we always tie the conversations back around. But I just had a little kid yesterday. I've been adjusting him since birth, and he's probably like 6 or 7, and he was talking about candy and Halloween, and he had no clue that eating sugar or candy, harms the immune system. And the mom knows, but she doesn't really know why. She knows, well, candy's not good, but it's Halloween, so one day a year they can eat, whatever they want or whatever. And then they're all sick the next week. So just using those opportunities to educate them and help them think twice about it and know what the science behind it is and what's actually happening. But a lot of stuff is coming out this year, and from the Vax movie specifically, but you all see this in your community. The main tactic the medical industry uses is fear, because they're getting people to do things out of fear. Like, you take this vaccine because otherwise you're going to get cancer. Do you want to get cancer? We had to go into the hospital recently with our infant for like a major thing, like an emergency situation. And it's all fear. It's like, well, your child could die if you don't do this. Your child could have lifelong seizures if you don't do this. And it's all pushing these medicines and all this stuff. And for somebody that's not super educated, a mother or a father, they don't want their kid to die. Like nobody wants their kid to have cancer. So you're like, well, death and cancer is probably the worst case scenario. This thing they're telling me is, going to help. I don't really know a lot about it. I got to make a split decision right now. Like, am I going to do this or not going to do this? Or am I going to say no to somebody that's telling me that, my kid could get injured or die? I obviously don't want to do that. So the best way to combat that is to educate parents before they're ever in that scenario, to have the tools and resources available to properly negotiate that situation to get out of it without CPS being called and their kids being taken away. And so it's a real weird dynamic in there because you have to challenge and you have to question, but you have to do it in a loving way that doesn't make them upset at you, because then things can get out of hand. So constantly educating your parents and moms about normal things that happen that aren't emergency situations and that aren't red flags that oftentimes they're told are red flags is super important. So let's say they're coughing, and a new time mom or a dad with one kid and they have a coughing kid, they're immediately thinking, is it whooping cough? Do they have RSV? Is they have pneumonia? Like, are they going to die? Can they not breathe? Am I going to put them to bed tonight and they're not going to wake up tomorrow? That's what's going through their head. And they take the child in, guaranteed, yep, let's give them an antibiotic. Let's give them this drug. Let's give them that drug. They don't know any better. So those are opportunities for you to teach parents. And if you can teach them before their kid even has the cough, but from your table talk or your handouts or whatever, like, hey, if they have a cough, that's a normal body mechanism of getting rid of stuff. They're going to cough things out. That's good. They're going to have a fever to increase the temperature of their body to fight illness, bacteria, and viruses. That's a good thing. They're going to have diarrhea. That's getting stuff out of their body. They're going to vomit. That's good. They're like, what? What are you talking about? Vomiting is good. Well, if you ate poisonous food and you took tons of stuff to make yourself not vomit because you didn't want to be sick, and that poisonous food just continued to go through your body, is that going to be better for you to take the drugs and push it down in, or is it better to just get it out? Well, maybe it's better to get it out. So talk through those things with parents so that they're not like emergency room immediately. See their kid has a fever. That's so important, right? And they're going to be afraid. What if their kid has a febrile seizure? Like the first time you see your kid have a seizure, they're going to freak out and it's an emergency situation. Well, research actually shows the kids that have febrile seizures are smarter and more intelligent than the kids who don't. I don't want to make sure my kid gets a febrile seizure, but it could happen. And it doesn't mean it's going to hit 104 degrees. It could happen at 100.5 with some kids. It happened once and never happen again. But talking about those things to the parent, when that happens to the parent, they're like, you know what? Dr. So-and-so told me about this. And they told me that this was going to happen or could happen. And it's going to be okay. Let's do this next, right? Leaving the door of communication open and letting them know, hey, if it happens on a weekend, something happens and you have a question and you're not sure, shoot me an email through the office. And I check that periodically. And if it's something I can help you with, I will, or respond to you. And just be available enough to answer those questions, because it's in the middle of the night is what happens, right? The kid wakes up with an earache and they don't know what to do. They remember you talking about it. They remember you shared that something, but they don't have the handout and they don't totally remember. They're like, hey, remember you told me to do something. I can't remember exactly what it was. And now you can give them resources and you can educate them and give them tools and almost like arm them with information that they don't get anywhere else. I mean, you think about what we learned. We go through school, we get degrees and as bachelor degrees oftentimes, and a parent can have a kid, and who told them that the most common childhood illnesses, and who told them how the body works and that it's normal? Nobody teaches them any of that stuff. They don't teach you how to be a parent and how to know this stuff. They just trust the doctor. If the doctor is going to use fear and tell them their kid's going to die, then that's what they're innately going to believe until they get harmed and something happens, and then they question and then they learn the hard way through that route. And so we have a unique position seeing so many kids and families that we can do something about it. And we need to be proactive with it. We need to teach families what are the most common conditions. And I just want to go through this with you quick. This is what's out there in media telling parents what normal is. The 10 most common childhood illnesses. Number 1's the common cold, and they say expect up to 5 bouts of this a year as a normal child. 5 common colds a year, which they say can last anywhere from 3 to 5 days up to 4 to 6 weeks as the common cold. If my kid had 5 colds lasting 6 weeks a year, I wouldn't think that's normal. And they're framing that around normal, which is just mind-boggling. RSV, they said, is totally normal in kids up to 2 years of age. So they're saying that's like the second most common. Third is roseola. Fourth is gastroenteritis. Fifth is the fifth disease. Sixth is strep throat. 7 is influenza, which of course they say get the vaccine early. It takes 2 weeks. The vaccine takes 2 weeks to fully kick in. So make sure you're getting it way ahead of time. Pink eye, pinworms, those are the top ones. And so I would be educating my parents on those, because guess what? Your kid has strep throat. They're thinking, oh my gosh, they're going to die. But look at the research around all the kids. You just go throat swab normal people. You're going to find that bacteria up to certain levels. They just all of a sudden determined, this is what we're going to call strep throat. And then this is what we're going to do to treat it. Well, maybe you don't. Maybe there's something else you can do. Maybe you don't have to treat it with antibiotics. Your body is meant to fight off bacteria and illnesses and viruses. If it's an ear infection, this one's so important because they give them antibiotics, and I think the research was 80 to 90% of the time it's a viral infection. So now they're getting an antibiotic for a viral infection. Well, some countries that's malpractice. If you give somebody an antibiotic as a medical physician without blood testing to show that they actually have a bacterial infection, you're giving them a treatment for something that they don't even have. And the course is 10 to 14 days anyways. So they give you the antibiotics for 10 to 14 days. It goes away. The parent thinks the antibiotic is what got rid of their ear infection and had nothing to do with it. More so, it probably killed all of the good bacteria in their body. Not probably, it did, and lowers their immune system and makes them susceptible to all kinds of other stuff, which is why they have recurring infections. Trying to explain that to a mom that has gone through that with several kids, they get it real quick, but they had to experience that, and that kid had to go through that. Now they have to rebuild their entire digestive system and go through all this. So if you can educate moms on the front end of that and tell them, hey, kids get ear infections for 2 main causes, viral and bacterial, and even the name of it sounds like it's an infection in their ear, like there's something, the bacteria got into the ear and it's causing the infection in the ear, and that's all we're working on. We're treating that, when really it's just an overall body immune system thing. If I keep my immune system strong, it's going to fight it off. So you treat it just the same way. Anytime your kid gets cold or sick, like, make sure you're drinking water, make sure you're taking, proper vitamins, whatever is going on. And you recommend vitamin D. I mean, we're in Michigan. We're supposed to get an hour of sunlight a day to produce proper amounts of vitamin D, and the sun's not even out like the whole month. So maybe they should be doing that. Like, what can they do proactive like that? And we don't sell those specific things in our office. You totally can, but they can be vital to that kid's immune system and immune support. And most parents just don't know that stuff. And so you could just put those 10 topics I just went over on repeat and just keep educating about those. Educate on strep throat. That one's so important. I just mentioned that. The 2, Fifth disease and hand, foot, and mouth disease are just scary names, right? I mean, your kid has hand, foot, and mouth disease, and their parents like, oh my gosh, I can't believe my kid has hand, foot, and mouth disease. What do I got to do, right? And so teaching them, okay, what is it? What does it mean? Like, is it contagious for how long? Like, what should you do? Like, the biggest one with parents is their kids just need to rest, right? They don't rest long enough, and they don't rest enough normally because they're busy. The parents are busy. They want them in sports. They want them in school. They want them to do all this stuff. So their body's just depleted of energy, and they just need to sleep and let their body recover for a proper amount of time when they're fighting something off, and give their body the best chance to heal. And so just teaching that and letting parents know they're doing a good job. I think that's another big one, is just encouraging them. Like, you know what? You're doing a great job. Yeah, your kid had a fever. You gave him tons of Tylenol. You lowered the fever. It made something that would have been a day into 5 days. But guess what? Next time, let the fever run its course. Watch for red flags. Teach them what the red flags are. Let them rest. Give them plenty of water so they don't get dehydrated. Number one reason they're going to go to the hospital for an issue like this is because they're dehydrated, because they never got any water. They're not keeping it down. So puking everything up. Same with flu, all that stuff. So stay hydrated, rest, try not to medicate them if you can. Most time it's parents, it's a process. They came from every time they had any symptom, they were fully medicated. I was that way. I got one cough, I'm in the urgent care. when I was growing up, I got every drug you can imagine. We had just piles of pills all over the house. If you had a headache or whatever, you took drugs. So it was a shift for me. It wasn't like one day all of a sudden, oh my gosh, I'm never taking a drug again. It was like, okay, well, maybe I'll see if that works. So next time I have a fever, maybe I won't take anything and see if it gets any better. Oh my gosh, it only lasted a day because the fever, helped kill. And then I wasn't sick for 4 or 5 days. And it's experience thing. So just no parents are like that. The last thing you want to do is make them feel guilty for the choices that they make, to make them feel like they're not, a good enough parent. And then just you don't want them to feel like they're being attacked. Even for vaccines, we have parents that come in that fully vaccinate their kids. I know how harmful it is, but me attacking them and just confronting them and saying, you're doing the wrong thing, you're making the wrong choice, your child could die, probably isn't the best way for me to connect with them, because they're going to lump me into the group of all the other non-vaxxers that they know that they're, are freaking out of them, and they're going to say whatever. But if I can come alongside them and just love them where they're at and let them know my stance and let them know I'm pro-education and I'm here for you if you ever want more information. You see stuff around the office, if you have questions on it, you want to see the research, you want to talk about it, you want to talk about the underlying root of what's happening with each of these, I'm available, and I'd be happy to discuss that with you guys. And so the door opens eventually. Let me tell you, the door opens. And if they open the door to the conversation, you're going to get a lot farther than if you force the door open and try to push them into something that they're being steered of. And you don't know the situation. Maybe their husband is super pro. Maybe their grandma or grandpa is super pro-vaccine. Maybe their brother or sister is, and they say, if your kids aren't vaccinated or don't do this, they can't even come around my kids. So there's a lot of stuff in the background that you just don't know. So tread lightly with those situations. But at the same time, be bold. Let them know where you stand. Let them know you're pro-education. Let them know, I would love to share more information with you if you're willing to receive it. This is the research. Here's handouts. Share all that stuff proactive prior to flu season. Give the flu handouts and talk about it. So that's mainly what I wanted to share with you guys today, is just be intentional about those common childhood illnesses and educating the kids and the parents. I love educating the kids, directly in the adjusting room. If I can speak to the kid and educate the kid is on board. And kids are so smart, you guys. They're the ones that you tell them and teach them why they shouldn't take something if they have a fever. They're going to be the ones, even if mom tries to give them something, they're going to be like, Mom, remember Dr. Erik told me, it's better if we just let it ride. They'll say stuff like that because they're super smart. And that, okay. The mom and the dad just wanted to feel better, right? I wish there was something I could do. And so by not giving them medication, they feel like they aren't doing anything. They're letting their kids suffer. That's really the root of a lot of it. So if you give them other things they can do to help their kid and make them feel comfortable and love them, so that they're not just not doing anything and they're suffering if they don't give them Tylenol, that gives them a way out and gives them stuff to do and encourages them. But yeah, teach the kids too. It's super fun. And the parents learn from all that. I mean, you teach the kid, mom's standing right there. They're going to know exactly what you're saying and how you're saying it. And they're going to nod and ask questions and stuff too, and keep it light and make it a fun environment. So that's my word for you for November. Have fun with it. Educate parents, educate kids, be proactive, take the initiative to put the time in and be organized. So you're doing it in a systematic way so that you reach as many parents and kids as possible, and enjoy the Thanksgiving season. I'll see you guys the first week of December. We'll close out 2019. But thanks again for ChiroSecure for putting this on and allowing us to share. Don't miss Dr. Monica coming up in a couple weeks. Her show is outstanding as well, neurologically based kids, and super, super excited to keep serving. So have a great week.
Today's pediatric show, Look to the Children, was brought to you by ChiroSecure and the award-winning book series, I Am a Lovable Me. Make sure you join us next week, right here at the same time. See you next week!